At least 38 countries have had reports of forced, coerced or involuntary sterilization over the past 20 years, with some of those cases involving women who are HIV positive. These women claim to have been sterilized against their will whilst giving birth. We look at what this discriminatory practice means for women's reproductive rights. And on a positive note, South Africa approved the use of the depivirine ring. It is a discreet and long-acting alternative to the daily oral pre-exposure prophylaxis or PrEP. And so in this week's episode, we ask, will this ring be a game changer in the fight against HIV? Welcome to The She Word, for real talk on stories connecting today's African women. I am Azizat Olaoluwa. A daily oral pre-exposure prophylaxis PrEP pill might not be the most desirable HIV prevention method for many, but there's good news for women. South Africa has approved the depivirine vaginal ring for use among women above 18 years as an alternative to PrEP. The silicone ring is inserted in the vagina to slowly release an antiretroviral drug to help protect against HIV at the site of potential infection.
28-year-old Akona, a resident of Masipumelele in Cape Town, South Africa, is amongst 1,959 women who took part in the trial for the depivirine ring.
I was at the clinic, our community clinic then. Then I saw people walking the streets recruiting for the study. So they approached me and then they told me about the ring, so I was interested and I took part in it. So I consulted my mom and then she was supportive of it. And then that's when I took the first step.
The depivirine ring is a silicone ring that is inserted at the top of the vagina and releases antiretrovirals over a period of 1 month, hence giving high chances of preventing HIV infections. The ring, invented by the International Partnership for Microbicides, targets women who are at risk of contracting HIV, particularly in developing nations such as sub-Saharan Africa. But perhaps why most applaud the invention is because it offers a discreet and long-acting alternative to the daily oral PrEP.
In 2005, we developed the first ring, and then we started testing whether the drug would come out of the ring. So we did a lot of acceptability studies. We talked to women in many, many countries in Africa. And so it was something that a woman would have control over. She wouldn't have to carry pills around with her. She wouldn't have to carry gels or applicators. It was a discreet method. And men ordinarily didn't even feel the ring unless women told them that the ring was there.
The trial required the women to put the ring every 4 weeks for 24 months. 6 years later, Akona is happy that the ring is now accepted for use in her country.
Over the moon. Excited that my hard work, dedication and commitment didn't go down the drain. And all in all, so it feels good.
She believes that the invention has come at the right time.
I was not sure if it was safe at the first. I went for it because HIV is so popular in my township.
South Africa has a high HIV prevalence of 20.4%, with 7.7 million people living with the virus. Nearly 2/3 of the new HIV infections in South Africa are among women. Now women from the age of 18 in South Africa will soon be able to access the product. Apart from South Africa, depivirine trials are also conducted in Uganda, Zimbabwe and Malawi. Zimbabwe was the first African country to approve the ring for use in 2021. Rollout will be delayed in South Africa as the health department studies the ring's effectiveness and costs. The price, however, is a concern to many who most need it.
The Global Fund for AIDS, TB, and Malaria has added the ring to their catalog of products so that ministries of health can apply for funds for the Global Fund, that PEPFAR, the U.S. agency, is a process for providing funds for AIDS, is also interested in the ring, so that there may be many options for ministries of health, departments of health, to be able to apply for funding for the ring if there aren't funds available in country.
Trials of the ring are also underway in Botswana and Namibia. Agnes Penda, BBC.
I am now joined by Elizabeth NAMUTEBI Ruth from Uganda, Duba Sakala from Zambia, and Oluwa Eniton Sophie from Nigeria. Thank you for joining us, ladies. Now, what are your thoughts on this development in the fight against HIV, especially for women?
Personally, I would say it's a welcome prevention method because I think when it comes to oral PrEP, which was there before we had the ring, some people do not like to take pills. So they had a challenge with it. And then also we had some women who were in probably abusive marriages where the husband would not allow the woman to take oral PrEP. And so the ring, I think, provides a discreet way of a woman protecting herself. Because remember, a woman has got rights over her own body. But then sometimes some women are in abusive relationships, or we may have maybe sex workers that probably might meet somebody who refuses.
Watching the video gladdened my heart. So understand that women have choices. What you notice is that many women, because of stigma and also the stress that comes with going about with pills, many women would rather prefer this kind of system because it means that you can be discreet with your diagnosis, number one. Then number two, you can also prevent it because having to take charge of your reproductive health is one of the biggest things that can work. And the question now is, where would other African countries adopt this?
This is a good initiative, though my query is the manufacturers of this ring, have they thought through the procedure of how they are going to sensitize the masses to convince them that this is a 35% proven method that can actually prevent HIV and AIDS? It's a good thing, but how about for the communities who are able to only earn hand to mouth? Will they be able to afford it? I mean, I feel like the best way for this to be perfect, to be, break out successfully, is for the ring to be completely free, no cost, to also help with people who have drug fatigue.
Indeed, accessibility is an issue, and everybody, of course, hopes that that is going to be free for everyone very soon, or at least they can afford it. Now, do you think Africa is making significant progress, in the fight against HIV and AIDS?
Yes, I feel that we have made a lot of progress. Looking back at the years, I think we used to have more of HIV infections in women because they didn't have this preventive. But now they have access to PrEP. Okay, they have access to PEP. So, and then for some whose partners would agree, they also would allow to use condoms. So I think we have really made a lot of progress. Here in Zambia, we have what we are calling Zambia and AIDS. And this is a campaign that is trying to promote HIV preventive methods. And I have seen how this campaign has really helped a lot of people be able to prevent themselves from getting infected with HIV.
Yeah, so I think we've made a significant number of progress, but so much more can be done. So much more can be done because so long as we still have stigma, so long as we still have people hide their status, then there's a lot of problem. When we have people really come out to talk about this thing, then it means that we can reduce the risk. Yes, we have done so much, but there's so much more to do, particularly in the area of inclusion. When we're talking about this, how well are we looking at people with disabilities? Yeah, so I think there's so much more to do, particularly in the area of inclusion.
Women have done a wonderful job trying to take their stand in the world of HIV. I feel like we have learned, we've discovered our rights when it comes to health. We know what we deserve, we know what we're supposed to go through and what we're not supposed to go through. We've been fully educated. There's so many NGOs out there that have done a wonderful job in sensitizing. And it can be seen in the fact that today we have young youth, peer educators all over the world trying to sensitize masses, either using media, using social media, going to communities. We have gotten to the point of where we go house to house, educating, mothers and children how to use contraceptives, how to use preventive methods.
Thank you for those insightful comments, ladies. I will come back to you in our part 2. Now, data from the Joint United Nations Program on HIV/AIDS indicate that over 1.4 million people are living with HIV in Uganda alone, more than 800,000 of those being women aged 15 years and over. Deborah Nakatude founded Serving Lives Under Marginalization, known as SLUM, to educate and offer reproductive health services to sex workers in the country's capital, Kampala.
She began her career as a peer educator for sex workers in Kampala, Uganda. Now, Nakatude Deborah is a grassroots organizer and advocate for health, reproductive rights for sex workers.
After that project ending, we sat down and thought of continuity of the work we've been doing as peer educators. That's how we came up with an idea of starting SLAM.
After surviving years on the streets as a teenage sex worker, Deborah saw a niche to attend to the reproductive health needs of sex workers. She organizes workshops on sexual and reproductive health and rights and provides sex workers with HIV treatment and information on prevention.
Deborah and some others used to move on our streets to check on us, giving us medicines, and they asked us to come for a blood check. After the checkup, they told me that I was infected with HIV. I felt so sad and confused, and I cried a lot.
I met Deborah while she and her team were in our area on a drive to test people for HIV. They tested us one by one, and when they found me without HIV, they introduced me to PrEP and they taught me how it prevents you from contracting HIV.
It is through her work that many sex workers in Uganda have been able to keep their health in check.
We've had reports indicating that the turn-up of female sex workers at different health facilities to receive health services was not so good. SLAM is a female sex worker-led organization. This alone makes it easier for other female sex workers to come and access services because they know this is a sport that is led by our very own. This is a sport where I can go and I feel safe to say that I'm a female sex worker.
Discrimination against sex workers is common. Therefore, access to a safe environment where sex workers get medical attention is key.
She has helped me a lot because she keeps encouraging me to take my HIV drugs on time, and she's given me the courage to actually counsel my fellow sex workers.
She gives us a lot of comfort in that we can freely open up with her. She is easily accessible and takes care of us. She's not judgmental. That is why we come here comfortably.
Through peer education, she is able to reach more marginalized groups and educate the sex workers on their reproductive health rights.
As an organization, we've identified peer leaders. We call them peer leaders or peer educators in different hotspots, either streets or brothels or bars. So these are people attached to different hotspots. We bring them, we identify them, we train them, and then they take on information. They create awareness. So it is through that approach that we can pass on information to sex workers.
We now take a short break. When we come back, we hear the stories of women being forcefully sterilized. We'll be right back. Welcome back to The She Word, for real talk on stories connecting today's African women. In 2020, South Africa's Commission on Gender Equality released a report that revealed state hospitals were sterilizing HIV-positive women without their consent. Here is the story of one woman who went through the dehumanizing experience.
I said, I won't be sterilized. They said, we are sterilizing you. We are not asking you. We are sterilizing you after we take the baby out. You're the same as a dead person. Although alive, you become a dead thing.
In South Africa, the UN says those living with HIV have been disproportionately affected by involuntary sterilization, despite the virus being manageable with medication.
These are such gross and such inhumane and so degrading, and we should not be allowing this, whether it's in law, in policy, or in practice, to continue.
South Africa has the biggest HIV epidemic in the world. About 7.5 million South Africans are living with HIV. Zishilo was diagnosed with HIV when she was pregnant with her third daughter.
Those days, people used to look at you as if you were an animal. When my family and neighbors heard that I had HIV, they sympathized with me. They accepted me. They told me that I should not tell myself that my life is over. It's not over. I arrived early, around 8 o'clock. The doctor came and said, "You'll have a surgery at 2 p.m. today. We'll sterilize you after the cesarean section." I said, I'm not getting sterilized because life is still going on. If you sterilize me, the father of my children might not want to marry me. The joy of a married woman is to have children with your husband. I said, no, I won't get sterilized. The staff said, we are sterilizing you. We are not asking you. We are sterilizing you when we take the baby out.
The South African hospital where Zishilo gave birth to her third daughter in 2011 says that before going into labor, her medical records document that she consented to being sterilized during her cesarean.
By the time I woke up after the injection, the doctor was putting his tools back down. He said, we did this because we care about you. I said, how can you care about me when I didn't agree?
A representative from the hospital said that because she had had 2 previous cesarean sections, it's standard practice for them to suggest women elect to be sterilized after a third due to the increased health risks of multiple cesareans. They told us,
women are not forced or coerced, hence some still decline the procedure and their wishes are respected.
But Zishilo says she had hoped to have more children in the future and claims she was forced to consent to the procedure because of her HIV status.
In our top story this hour, the Commission for Gender Equality says that
the state enforced sterilization of HIV-positive women. It found that pregnant women were being coerced into signing consent forms.
The South African health system, as well as the government broadly, is failing the women. The department itself is yet to accept and acknowledge publicly that these gross violations happened under their watch.
In response to Zanale's allegations, the spokesperson for the Regional Department of Health told the BBC that
the department is prohibited by law from commenting publicly on patients' confidential clinical information without their express written consent. That said, the department has evidence that is extremely contrary to what is being alleged, including written consent to tubal ligation in 2014.
South Africa's Ministry of Health has not responded to the BBC's request for a comment.
A sad story indeed. Now, ladies, the UN Special Rapporteur on the Right to Health described such a practice as gross, inhumane and degrading. What are your thoughts on this?
Okay, yeah, so this is very sad to watch. And I would say that to a very large extent, if we can have persecution of doctors or medical personnel who do this, then it's going to reduce that to a very large extent because people need to be enlightened that we need more of empathy. HIV itself is not a death sentence, and we have been living with this with a lot of innovations that is helping us live with it. People with HIV deserve to live quality life and have quality organisms.
This is a very sad video to watch. I believe HIV is just a drop in the ocean and a person's life should not be decided over that. This is the true definition of misconduct, violation of human rights, and violation of code of conduct for medical practitioners. I mean, laws should not only be put in place, but they should be actually enacted, you know?
That was very sad to watch, really, because I think the pride of a woman is in her ability to be able to give birth, to be able to bring children into the world. And then you have that kind of stigma and discrimination against a woman living with HIV and not allowing her to have children just because she has HIV. I mean, look at where we're coming from. Yes, at first we didn't have all these preventive methods. We didn't have a PMTCT. We didn't have EMTCT. But here we are today, a woman that is on effective treatment, that is adhering to her medication, has attained an undetectable viral load, is not able to pass on the virus to an unborn baby or even her breastfeeding child. So it's really kind of disheartening that this was happening in SA, and that this woman had to be subjected to that because she had the right to have as many children as she wants if she was able to take care of them.
So for such women living with HIV, what should be done to protect their reproductive health rights?
For people living with HIV, I think it's so important to have them enlightened and to also have channels in place where they could get redress or they could seek redress if they come across any form of abuse or violation of their rights. It's totally unfair that the person will be faced with double jeopardy. One is that you're living with the virus, and the other one is that you have to live with stigma in constricted places. It's totally unfair, and I think that a lot needs to be done. No medical personnel has a right to bring their bias to their profession. They have sworn to take care of people, and they need to be sure. Gone were the days. I mean, this is 2022. In the early years when we didn't have access to the information to take care of a woman or anybody with HIV, it could be excusable. That's still not excusable. But talk about 2022 when we have a lot of information that can help protect people, then it's a risk to everybody because more women will try to hide their status if they know that they will be subjected to such a violation of their rights.
The women need to be given enough and equipped with enough information concerning their medical health rights. And once that is done, any doctor who tries to, or any medical practitioner who tries to coerce them into this type of thing, sterilization, can be brought to justice. And once they are brought to justice, we can provide them with, we can be able to terminate, or the judiciary could be able to terminate their medical licenses. All we need to do is give women adequate legal presentation and be able to, educate them about the effects of sterilization. To be able, I mean, I know women who will welcome this idea, who are okay with it, but for those who are not okay with it, I feel like they should be educated, the pros and the cons of this, and let them fully decide on their own and not be threatened.
I also feel that we need strict laws that are going to protect women living with HIV from being sterilized against their will. Because if there's a law in place, then the woman knows to say, if I'm sterilized against my will, I'm able to sue this particular health facility. I'm able to seek legal redress because I have been sterilized against my will.
Ladies, thank you so much for your valuable contributions on this topic. It was great having you on the show. Now, moving on to a quite inspirational piece. At just 18 years of age, Angela Okutoyi looks like she could be the future African queen of tennis. In January of this year, she became the only African to win a match at the Australian Open's Junior Championship. She's also the first Kenyan woman to win a Grand Slam match. Inspired by the great Serena Williams, the route into elite tennis hasn't been easy for her. But coming from a poor background in Kenya, Angela was raised by her grandmother after her mother died, giving birth to her and her twin sister, Rosie, who is also a tennis player.
When I was young, it wasn't really easy. Some days I was going to train without eating. Tennis means everything to me. It gives us the meal we have now at home. The fact that I'm on that court, I know it's something that's going to help me in the future. I started playing tennis at the age of 4. Hello, coach.
By the time I identify her, apart from all the other group, some of the kids, they drop up. But Angela is a girl who fights, who don't give up.
I was wearing torn shoes. I didn't have most of the equipment that I have now.
Split steps up.
My grandmother is the one who drives me. So seeing her happy makes me happy. She had to take care of us and do everything by herself. In one shoe as a father, a mother, and a grandmother.
Their mother, my firstborn daughter, died during surgery while giving birth to Angela and her twin sister, Rosie. They never saw their mother. I have tried my best to help her in tennis. We used to walk on foot to take her to tennis matches. The moment Angela was picked by the International Tennis Federation Center, it was like a dream come true.
Welcome to my trophy cabinets, African Championship, and this is the one that gave me the opportunity to go to the Australian Open. Even before stepping on the court, at the hotel itself, I met some big players. One, I can say Coco Gauff. I met also Madison. There are so many things I won. The Under-14 African Championship, it was in 2018 in Algeria. And that same year, I won the Kenya Open, the youngest to win it. And 2021, I became the African champ under 18, which was really special. One thing I love about the sport is that it teaches you to be independent. It takes determination, discipline, and belief. I usually wake up early morning and train, and then I also have a schedule to do school. I also have to help at home, cook.
I'm seeing her playing Grand Slams. She's not far from there.
This is my prayer.
My prayer is for my daughter to get the support she needs to enable her to continue competing. Angela will succeed and we will celebrate more.
My dream is to get my grandmother out of where she is now and to remove her from poverty and build her a house and get her a good life. My future goals in tennis is to see myself playing at the big stages, and I believe I can make it.
A remarkable young lady there. Indeed, no one is defined by their experience. All you have to do is dream it and believe it. That's all we had for you today. Be sure to catch this and more exciting episodes of The She Word on our BBC website, www.bbc.com/sheword. Thanks for watching and goodbye for now.